In this video I will be describing the condition retinal detachment, and this video should be viewed in conjunction with my previous video on floaters, which describes the problems that occur within the eye leading up to the development of a retinal detachment. It is a rare condition, but certain people are more predisposed to retinal detachment, and this includes short-sighted people, where a short-sighted eye is a big eye and the tissues are thinned and stretched and more prone to retinal tearing. Also, if there is a strong family history of retinal detachment, this increases the risk of a detachment occurring. So, as has been mentioned in my previous video, it is the vitreous pulling on the retina that creates a tear in the retina, and then the watery component of the vitreous passes underneath the tear and results in the retina detaching from the back wall of the eye. Now, the retina is part of the central nervous system and requires a very good blood supply in order for it to function. And when the retina separates from the back wall of the eye, it comes away from that blood supply and therefore can no longer function. And this results in a blurred patch in the vision. And the retina usually starts to detach from the periphery towards the centre, and therefore the symptoms associated with retinal detachment are a shadow in the periphery of the visual field passing towards the centre. This tends to occur over hours or days rather than seconds or minutes, but it is important, if it does occur, to have a medical attention as soon as possible, because the prognosis for surgical intervention is far better if it's caught at an early stage, and in particular if you have what is called a macular on detachment. The macula is the name given to the central part of the retina, that part of the retina we use for central visual tasks such as reading, writing, recognising faces and colour. And if the retinal detachment has not yet affected the central part of the retina and can be reattached surgically, this results in a far better prognosis than if the retinal detachment has progressed sufficiently to cause the macula to become detached and away from its blood supply. Because the retina is part of the central nervous system, it doesn't have to be away from its blood supply for any great length of time for the cells to start deteriorating, and even though we can then successfully reattach the retina anatomically, it may not function as well as had it not detached in the first place. And this is the reason why urgent intervention is required.